The subject is slightly different on what we discuss routinely, but it's a very important topic and it's the need of the hour. In the medical curriculum, both MBBS as well as post-graduation, it has been found that the focus is entirely on the algorithm-based approach, diagnosis and treatment of the patient. Often in this approach, the patient angle or the patient emotional angle gets neglected, and that results in a lot of frustration, and end result is that even when the right therapy is there and right diagnosis is there, the patients are not satisfied and they leave the hospital and doctor with a grudge. Sir, I would like to have your opinion on this subject.
No, I think you are exactly right. The classical approach for medical profession has been that you have to treat the patient who's on board and and disconnect with emotions. So you kind of treat patient like a machine, and if that machine has got wrong, you fix that machine. So, and that process starts right from the day one. So when you enter your anatomy lab, you see a cadaver lying there, and what you are expected to do is to go and cut that and dissect it and to find out the disease or whatever anatomical correlations between different things, completely ignoring that now this was a former human being actually who's lying there, and all the emotional aspects are actually taken away. You don't treat it like a human being who has been unfortunate to lie there, but treat it like a machine and kind of cut it apart and find out what is what. So I think, and that particular training goes right on till the end of the training, where the prospective doctor is trained to keep the emotions away and treat every disease like a machine process which has gone wrong, like a machine which requires fixing, and fix it like that. And so you might have heard people saying that, okay, this is my father, how can I treat him? So we find another physician to come and treat my father, because I cannot treat my father, because then emotions will come in. But I think that particular approach is completely flawed in current circumstance, because what happens is that emotions are integral part of the disease process. Not only disease process, are the integral part of the human being that we are treating. We are not treating a particular defect. We are treating the whole human being. And if you ignore the emotions, then you ignore the human being, human component, and you try to treat him like a mechanical problem. So that is why this whole thing comes in, and that is why what happens now, we see that there is a disconnect between the doctor and the patient. So that disconnect happens. A classic example is, say, terminally ill cancer patient. So medicine is, the main reason for medicine, as many people will tell you, is to prevent death. But in a terminally ill cancer patient, you cannot prevent death. That is inevitable. In any case, every human being who has come here has to die. So if you focus as medical profession's first job to prevent death, then it has already failed, because everybody who has come in will going to die some point of time. So that means that medicine has already failed, because you cannot, although you can prolong life, but you cannot prevent death. So that is why I think the focus of medicine should shift from preventing death or preventing death to holistic approach to the whole patient, where all his concerns are addressed. In a terminally ill cancer patient, you cannot prevent death, but you can give him support, you can give him emotional comfort to bear the death, to bear the pain that accompanies that particular thing. And I think at that point of time, that is the most important thing to do. So I feel that medical curriculum should be completely revised. Another problem of medical curriculum is that they take a course of science which is completely away, and that makes the person who's engaged in that particular process, because the training is very long, it might take 10-15 years to train properly into the medical profession, and by that time the doctor gets disconnected from society, because he's focused into only himself and the patients. Sometimes he even ignores his family, because 14-15 hours he has to spend with his job, with learning, education, etc. So he even ignores the family, and therefore you see that the suicide rates are highest in the medical profession. Among all other professions, suicide rates are highest in the medical profession, because it completely disconnects. Man is a social animal, and if you give away the society, you become disconnected from the society, then very high chance of suicide rates. So paradoxically, doctors have the highest suicide rates, and that is the exact reason, because they disconnect. So I think, not only medical things should be included in curriculum, but some literature, some philosophy should be included as a part of their curriculum, so that they have an overall development in the society, rather than act as an observer outside the society looking at the patients.
Any suggestions, any ideas you will give? What you have already said that philosophical should be one of the subjects, but to make it more practical, what can be any suggestions you can give?
I think simple suggestions are that in the curriculum itself there should be case scenarios with emotional attachments, and you can show them those particular case scenarios where, like terminally ill cancer patients, there can be sensitization towards death, where they visit the wards where people are dying actually, and then therefore they will not ignore death. People kind of postpone this death and they just look at life, but death is also part of the thing. So have training there. Another very actually interesting experiment, there was a movie, I don't know whether any of you have seen that particular movie, which was Clockwork Orange, where there was a kind of criminal person with a criminal bent of mind. So what they did was they sensitized him to all the violence in the society. And so in that movie, what they did was that he was shown these images, graphic images, where his mind was changed as a result of these images, and he became more receptive to the society. So that experiment was carried out. Similarly, I think some of these tragic movies may be shown to doctors, where they can appreciate the pain of the people who are involved there, and that can help them. So these are some of the practical examples. Also, philosophy should be part of the curriculum. They should have one course in philosophy, one course in arts, because arts does two things. It shows you the similarities and also the dissimilarities, so that doctor also can basically associate with the patient or also dissociate. Both these values will come out. So arts, philosophy, they should be regular part of curriculum.
Often the doctors also see patients as one individual. They forget that every patient has a family and their relatives are there.
Right.
And once he goes back, there will be a family life, there will be a society in which the person is going to live. The focus is entirely on the disease management.
Exactly.
So any ideas on that how instead of patient treating as one individual, the entire family in which the patient lives can be taken together?
Yeah, so when patient is visited, there should be family members there. Anything treatment wise, anything that is discussed should be done in context with the whole social situation. And I think all these things are part of it, and that particular training should start right from the beginning.
Another different topic, although somewhat related, is in India we have been seeing increasing violence against doctors, and this has happened more commonly nowadays. And this is actually resulting in a lot of frustration and kind of a separation. It's increasing the gap between the doctor and the patient. Doctors are becoming more and more careful. They are ordering for more investigations. They are trying to be more cautious in discussing with the patients about their prognosis and treatment and so on. In a way, it's affecting the way that patients are getting managed. Sir, any of your opinion or any ideas on that?
No, I think you are exactly right. I think violence against doctors and other healthcare workers is now taking an epidemic proportion. There does not go a single day where you don't see a report where we recently hear that one dengue patient died and the relatives got together and beat up the doctors and also the staff. Now dengue sometimes can be life-threatening. Likewise, if a cancer patient dies, how is doctor responsible? Doctor cannot give you immortality. They can only take care, prolong life, maybe take care of some discomfort. That's all a medical personnel can do. They cannot prevent somebody from dying, more or less. I mean, negligence apart, this is the usual story. So how do you make doctor or any hospital or anybody else responsible for an unfortunate circumstance that anyway happens? If somebody dies of road traffic accident, you can't hang the prime minister of the country because somebody died. So I think so these are some grossly overreactions, many cases. But let us go philosophically into why that happens. So what has happened over a period of time, initially the situation was that between the patient and doctor relationship has changed. Initially it was a parent-child relationship. So patient was a child and doctor was the parent. And as we know that parent knows what is the best for the child, and child accepts whatever the parent tells, or because he acts on his behalf. And there is no, kind of not big discussion or argument between the parent and the child on any aspect, including even sometimes later on, in marriage and in, jobs, etc. So, but initially that kind of relationship was present. Now that relationship has changed, and it has kind of become a client and a delivery or a vendor kind of relationship. So I think that change in relationship is the reason for all these problems. Now you would ask me why this relationship has changed. So remember, say 50 years back, dominant population was divided into two classes. Either there were elite, which were of course a minority, 5% or so, 95% were working class. So working class, basically, the whole philosophy is discipline, following the rules, and you will see that these working class are always, in a uniform and things like that. So basically for them, discipline is the most important thing. They will never go against the rules. But what has happened is suddenly this another class has come in between, which is the intellectual class. Now intellectual class is defined by, challenging the authority, by asking questions, by, questioning everything actually, as a matter of fact. And if satisfactory answers are not given for these questions, so if the parent does not satisfactorily answer the child, then child gets violent. So same kind of thing is happening. The patients have certain questions, they have certain dilemmas, they have lot of things, and doctor somehow doesn't have either time or doesn't want to answer these questions, doesn't address these questions. Then there is a disconnect, and then naturally there is no other option but to resort to violence sometimes. Therefore I think so as you said, how to address this problem, now the time has come where you need to carefully discuss everything with your patient, give him or her the right perspective, give them lot of literature to read, and so that they themselves come to the same conclusion as the doctor has already reached, that okay, this is the best course of my treatment, and these are the issues, these are the mishaps that can happen. What commonly happens is that in our context, for example, if somebody comes for angiography, you ask him to, okay, we'll do an angiography, we'll find out what the disease is. But the doctor did not tell him that, okay, angiography can be risky, sometimes very occasionally people can even die out of it. Now if this person has come walking, got an angiography done, and statistically some people die out of angiography, and if he is unfortunately one of them and he dies, then very likely the relatives will may behave violently against the doctor, because now here understand that the gap has been at the level of communication. So I think this is the era of communication. Doctors need to effectively, accurately communicate the problems with the patients, and if they are unable to do so for any reason, whether they themselves lack that information, or whether they don't have time, or whether they have that still parental-child relationship kind of attitude, if any of these things are there, then there is a high probability that violence will happen. So people who come for dengue, they have to be clearly told that some of them can be died. We will try our best to save it. This is the problem with your patient. He is a higher risk for dying. We will still try, but we cannot promise, and things like that. And then if dies, then you can say that, okay, we tried. But if you say that, okay, dengue, nothing, no problem, we'll just give some fluids, that, and also, don't address their concerns properly. So they come out with some symptoms that, no doctor, he's gasping something, and you say, okay, we'll see, we'll come, and then if you dismiss those things, then that is the point where this disconnect will happen, and so the violence can happen. But of course there is the societal aspect also. Society also needs to understand that there has to be, you have to follow the rules. Even if the doctor is negligent, there are some other authorities who will address this problem. You are not the one to address that problem. So you can take him to court, they can decide the kind of compensation, they can even put him in jail if the gross negligence is found. But the patients are nobody to react against this. There is a law enforcing authority, they should be informed. So if that particular part clear from both sides, I think these problems can be solved.
Thank you so much, sir. Very nicely you have summarized both the sides. Doctor needs to be more careful in addressing the prognosis, and also need to be talking to the patients and their relatives about what's going to be the end result of the treatment, which is going to, not promising falsely that everybody can get cured. And similarly on the patient side, there we understand that there is an emotional angle when the relative is dying, but they are not in a violence cannot be justified in any situation. There are authorities whom they should talk and they should discuss. Thank you so much for your taking time, sir.
Thank you.